This is Dr. Daniel Paul with Easy Orthopedics, and today I'm going to talk about, do heel spurs go away? So the short answer to your question is no, heel spurs don't go away, but that's not the whole story. So what is a heel spur? Well, you've got this bone on the bottom of your foot called your calcaneus, your heel bone, and sometimes on the bottom of that bone, the calcaneus, you can get a little spur off the bottom. And people tend to get really focused on this spur. So, well, first, how do you tell if you have a bone spur on your foot? Usually a simple x-ray will tell you that. You can see it, it's clear, you don't need an MRI, you don't need a CT scan. Usually just an x-ray will tell you, yes, you have a heel spur. But the problem is getting focused on the heel spur, because a lot of people have heel spurs that don't have any pain. Really what happens is that somebody tells someone they have a heel spur, but really what they have is plantar fasciitis. And that's what's causing their issues. And plantar fasciitis causes the heel spur, not usually the other way around. So people get focused on the heel spur when really they should be focused on the plantar fasciitis, which is this, the plantar fascia is a tight band of tissue on the bottom of the foot. It goes along the length of the arch. And sometimes that can become inflamed and hurt. People will experience pain when they get up in the morning, first thing, and so if you do have pain in your heel, and someone's told you it's a heel spur, I would really get evaluated and make sure that this is actually plantar fasciitis, which it probably is. And then once you know that, then you can focus on plantar fasciitis specific treatment. So that can be specific stretching, stretching of the calf and actually the plantar fascia itself. You can do it at home, but it always helps to do it with a physical therapist. If it's still painful after that, then you're talking about wearing splints at night. Rarely ever does it need surgery. But yeah, the point is not to really get too focused on the spur itself. Now, if you do have this spur, people ask, well, can I walk with this spur? If it doesn't hurt, you can do anything you want on it. Most of the time with foot and ankle pathology, unless you're diabetic, if it doesn't really hurt too bad, usually means things are pretty much okay to walk on. And if you can walk on it, usually that means it's fine. So don't get worried that you have a heel spur on the bottom of your foot that's going to snap off and float around in your foot. That's not really going to happen. But yeah, most of the time it's just plantar fasciitis. You get the right diagnosis and treatment, the pain's gone, and you have the spur at the bottom of your foot. You never feel it, and you forget about it. So I hope I was able to answer your questions. If you have any questions I didn't answer, feel free to leave them in the comments below. I'll do my best to respond. If you like this video, we put out new content every week, so please subscribe and hit that like button. Thanks for watching.